Bismillahirrahmanirrahim. I'm Dr. Mohibullah Wazir, and the topic is the esophagus. Note: esophagus is a tube made up of muscles, muscular tube that extends from the pharynx, from the pharynx, and reaches to the stomach over here, reaches to the stomach, and it is the food pathway. They take the food from the pharynx to the stomach. It is 25 centimeters in length, and note the point that the duodenum is also 25 centimeter long and the ureter is also 25 centimeter long. It starts from the lower border of the cricoid cartilage from the stomach level with the cervical 6 vertebra, and then it descends downward, enters into the thorax through the thoracic opening into the superior mediastinum, then into the inferior mediastinum, and then it passes through the diaphragm. It passes through the diaphragm level with the thoracic 10 vertebra, and then it enters into the stomach level with the T11, T11, T10, and cervical 6 vertebra. Okay, then note one point: in the midline of the neck, most posteriorly, is the vertebral column, then is the esophagus, and then is the trachea. The esophagus lies between the prevertebral fascia and the trachea, and it descends. Some part of it lies in the neck region, which is called as cervical part of the esophagus. Then some part of it lies, and most part of it lies in the thorax, that is called the thoracic part of the esophagus. And very small part of it lies in the abdomen by passing through the diaphragm, and that is called as the abdominal part of the esophagus. Now, the course and relation of esophagus is that it starts in the cervical region from the pharynx, from the lower border of cricoid cartilage level with the C6 cervical vertebra, and descend down in the midline. Then, then lower down in the lower part of the cervical region, it deviates slightly to the left and enters into the superior mediastinum. And in the superior mediastinum, it enters and passing again posterior to the trachea and also lying posterior to the heart. Trachea, and then the great vessels, and then the heart. And again at the thoracic 5 vertebra, it again comes to the midline. First in the midline, slightly to the left, then again come in the midline. And then note this part: at the level of thoracic 7 vertebra, the esophagus now deviate toward the left and in the forward direction. First, it lies in contact with the posterior abdominal, posterior thoracic wall, and in the midline. Then it deviates toward the left and in a forward direction. And at the level of T10 and to the left of the midplane, and to the left of the midplane, it pierces through the diaphragm level with the C7, with the thoracic 7 costal cartilage, and it enters into the abdomen. And when it enters into the abdomen, now note this point very clearly: when this right crest of the diaphragm, make it very clear, it make a sling around the esophagus, the right crest of the diaphragm. It makes a sling around the lower nerve, the esophagus, and now it is somewhat 1 to 2 centimeter in length, and now it enters. This is the esophagus, and it enters into the stomach. This is the general course and relation of the esophagus. The detailed cervical, thoracic, and abdominal part I will discuss in the next lecture. Thank you.